So, dear colleagues and colleague Pinera, many thanks for the invitation. It's a great honor for me to be here today and to share some particular results of long-term research that we are conducting also for many years together with Saxon colleagues from Memorial of Pirna Sonnenstein and even Nach Arendt Institute, as I can see. So this particular story is actually not final result in a way. We hope that in the future, perhaps in collaboration with the colleagues here from Saxony, we can even forward this topic a little bit further, just because it's a very complex and cross-national issue. The topic, as you can see, is concerning the patients, as we call it, that were transferred from Saxony to the Czech lands. Of course, Czech lands means both Bohemia, Moravia, and a small part of Silesia. And as I will highlight later on, it's just more an issue of Saxony and only Bohemia. The lecture or the paper is structured as follows. First, I will try to make some overview of the current stage of the research. Then I will go very shortly through the importance of the Nazi euthanasia and the several actions, the phases, and so on. And third, we will move to this particular story of the patients that were transferred from Saxony to Bohemian psychiatric hospitals. So, very short introduction, please, the next slide. There has been already several books or works or volumes published on this topic. We have tried from the very beginning to make them available also in German language. So in 2010, there was this Sonnenstein heft that was devoted to the first transports to death from the territory of the Czech Republic, which actually concerned the psychiatric hospitals in northern Moravia. The places are Troppau and Sternberg. This year, it's a kind of invitation. It's the 85th anniversary of this first transport of several hundreds of patients, both of German, Czech, Polish, and Jewish origin, to the Annihilation Center in Pirna Sonnenstein. So on December 15th, there will be an official memorial celebration in Pirna Sonnenstein. Then we have tried to collect even more knowledge during a small European project that we were granted. So in 2016, we have published this volume in Czech and German, where also the contribution on this particular story of the Saxon patients from Arnsdorf, from Christoph Hansik, is included. And then in Czech in 2023, me together with my dear colleague, Dr. Novak, we have published a sort of synthesis of about 600 pages on the euthanasia in relation to Bohemia and Moravia. In the meantime, of course, the shift in the research of the history of this first mass killing program of the Nazi regime moved also at the international level. So the knowledge that we have been able to collect in between was incorporated into the more or less international volumes. So these two were probably the most significant. The first one was conducted by the Heidelberg Group for the History of Medicine and Nazi Euthanasia. And there is a chapter of the impact of Nazi euthanasia in different European countries. So not only, I mean, Bohemia, Moravia, but also Slovenia, Poland, and so on. And then there was in 2022 this volume from the colleagues in Frankfurt, which targeted just the Nazi euthanasia in context of the Nazi crimes in occupied Europe. So there was a shift even towards much more complex and complicated issues, as for example the hunger or starving death in the Netherlands or in occupied France, which until recently was completely unknown. Please. So what we are dealing here in the Czech case is that actually the country or this region, as you may know, held a particular position within the Nazi euthanasia, just consisting above in a heterogeneous ethnic structure of inhabitants. Bohemia, Moravia was divided after 1938 and 1939 into more or less two great administrative units, the so-called Reich District of Sudetenland with German inhabited population, and then after March 15, 1939, the Protectorate of Bohemia, Moravia. However, the population was, of course, mixed quite extensively. So, for example, in the Reich District of Sudetenland, you had about 300,000 of Czech inhabitants, and then in the Protectorate again more than, I think, 230,000 of German inhabitants. So this is a very specific and important point of departure for the planning of the Nazi euthanasia in this heterogeneous ethnic structured area. The Action T4 that started in 1939 and was ended in August 1941 by Hitler personal decisions in 1940 and 1941 was to be focused solely on the patients of the German origin in our country. It means both in the so-called Reich District of Sudetenland, the border areas, and the Protectorate of Bohemia and Moravia. The problem is, as will be shown later on, that this rule, this sort of key decision made by the table in Berlin or Berchtesgaden was not in practice followed. One of the consequences of starting mass transports of patients within the Action T4, obviously having been calculated from the very beginning, was obtaining, among all, also the space for admitting the Reich German patients, especially from Saxony, in the psychiatric hospitals in our country or in these regions. So this trend, when actually we are facing with the transport from the Reich to both Reich District of Sudetenland and even Protectorate, was also the case later in the second phase of the Nazi euthanasia after 1941, especially during the years 1942 and 44, during the so-called circumstantial euthanasia and total war. If we would like to look how the analysis can be structured, of course, what should be included are the perspectives. We can follow the impacts of these actions, euthanasia actions, for example, at local level of the city, or more cities, or at the level of the region, what we have tried in that volume from 2010, but we can also compare, since or if we get the sources in supra-regional and supranational level, which is the case, of course, between Bohemia and Saxony. There are several aspects, at least three, that seems to be important just despite the statistics. These aspects are making the analysis important and interesting in understanding what the dynamics was, how perhaps the decision-making process in the Nazi state between the different authorities was conducted. For example, the first one is the administrative aspect. We know that actually the authorities both in Saxony and Reichsgau-Sudetenland, or even the German authorities within the protectorate, cooperated, were in touch with each other. But not always we can find the sources, all sources left. But definitely this is one aspect that was crucial. Then a very special and complicated one is a financial aspect, because all these transports and the fact that the patients stayed in another region or in another country had significant financial consequences, because the patients and the stay of the patients used to be paid by somebody, by some entities. So there was an enormous, not struggle, but a quite extensive exchange of who is going to cover the stay of the patients, under which circumstances, and so on. It's a dimension, I would say, that is still understood quite little, and we need to make much more thorough analysis in the future, perhaps, because there are even the stories how perhaps within the Nazi state and within the Nazi structure, one entity used or tried to use the financial sources of another entities, you know. So it's pretty complicated, but it should be done. And the third aspect is, of course, very, let me say, special one. It's a medical one. So this is needed to be analyzed also in the context of the given healthcare system. The problem is that actually the healthcare systems, although they were quite similarly developed from the 19th century in Central Europe, differentiated from each other. So the healthcare system, for example, within the protectorate was quite different than in Saxony, for example. And this resulted also then in the practical healthcare of the patients. And if we ask then, especially in the second phase of the Nazi euthanasia, why so many patients died at that time, we need also to handle with this aspect of the medical healthcare system. Because, again, it was about the sources, it was about the finances, it was about the personal stuff. For example, we know while in Germany or Altreich, in Reich district of Sudetenland, there was an enormous lack of physicians, just because the German physicians needed to be recruited for the Wehrmacht. It was not the case in the protectorate. We have a very strange phenomenon in the case of Reich district of Sudetenland, for example, that there was quite a large number of the Russian physicians, which became from the emigre families of the Russian after 1917. So these are just some of the huge question marks for the future as well. So please, the next slide. This is actually to give you the geography of the given territory. The brown area, that's the Reich district of Sudetenland, with these three. And do we have the pointer? No,
it doesn't
okay.
work.
It doesn't
work.
If it works.
No.
Okay. Now, three largest formerly regionally government psychiatric institution in Western Bohemia, Dobřany Wiesengrund. This is relevant for our story. Then we have these two in the northern part of Moravia, Troppau, Opava, and Sternberg. These are not relevant for our story. And then the white area, that's the protectorate, divided into these two historical countries, Bohemia and Moravia. And as I mentioned, for the Saxon Bohemian story, only Bohemia is relevant, with the psychiatric hospital in the northern part, not so far from Jungbunzlau, Mladá Boleslav, where the Škoda factory is today, of course. And it was called Kosmanosy Kosmanos in German. So I will use just the German terms. So next slide, please. Here is just the same overview, only in, let me say, another structured text. All these institutions developed historically from the second half of the 19th century, while the biggest of them, and that's also then relevant for our story, was really Wiesengrund in Western Bohemia, which was about the capacity of more than 2,000, several hundreds of beds at that time. Next slide, please. Yeah, this is the rough overview of the transports during the Action T4. That means the organized phase of Nazi euthanasia from the territory of today's Czech Republic. You can see the minimal numbers of patients, victims, with the annihilation centers both in Pirna-Sonnenstein with the so-called Zwischenanstalten and Hardheim in Upper Austria. The span of time we are dealing here is really between December 1940 and summer 1941. The German patients within the protectorate should be concentrated in Kosmanos in one psychiatric hospital, and should be transported to Pirna-Sonnenstein in September. It was planned, it was prepared, but because of the stop of the euthanasia action, they stayed in the hospital, so actually they were not transported to Saxony. Now, a significant subgroup, which were the patients from Saxony. Of course, we have a problem here. Who was a Saxon patient? So we sought for simple and practical criteria, however simplified they might be, of course. So we have chosen the patient's domicile. It means that from our point of view, these patients were transported from Saxony, but it doesn't mean that they were of Saxon origin, of course, or originated in Saxony. There were even foreigners. There were also the people who were sent by this transport from the Umsiedlungslager in Saxony. So the ethnically German people from Russia and Eastern territories. I think that we have in the case of Arnsdorf, I am going to talk about 26 of them, for example. And of course, then there is also a number of those people we cannot identify properly. So then we use the place of birth only as an auxiliary sign that actually in the cases of these incomplete data, they came from Saxony. But throughout analysis of this whole cohort is of course quite an issue for the future. So about the grouping, first we have the transport from Arnsdorf to Wiesengrund in April 1941. And that is the first significant group of these patients. And then we have after 1941, to be more specific, in 1942 and 44, the patients that were transported in two transports from the Saxon psychiatric hospitals in Hochweichen and Großschweidnitz, with, of course, together with some student patients staying also randomly in Bohemian institutions on individual or perhaps family basis as well. So the reason for this dichotomy is the relation to the dynamics of the action T4, actually. Please. Amsdorf case, there was this transport of 485 patients from April 22nd, 25th, 1941 to Wiesengrund. And as a consequence, there was a semi-official, not institution, but semi-official part of the psychiatric hospital in Wiesengrund that was called as Außenstelle Amsel within the psychiatric hospital of Wiesengrund. Here, for example, this is the example for how the administrations cooperated. It was an improvisation, we can say, but definitely it was important and relevant for the fates of the patients. So 13 Amsdorf patients originated primarily in Sudetenland and as remains of the complex events after the Munich Agreement, because after the Munich Agreement of 1938, there was the so-called exchange of the patients. As I mentioned, there were these 26 patients, Volksdeutsche, from several camps in Saxony, so they were included and transported there as well. 2 patients were non-Germans, and 5 patients were of not age. That means very little juveniles. Interesting here is the males-females ratio, which you can see is 130 to 355. So it means that roughly 1/3 were males of the patients and 2/3 were female. The first one, the first patient from Arnsdorf transport who was registered in Wiesengrund was Elsa Gärtner. Here you can see the dates and the basic information. If you can then move to another slide. It's extracted, all the statistics is extracted from the admission book of Wiesengrund that we were happy after several years to get and to analyze. All the data have been then also confronted with the death registers in the case of those patients who died in Wiesengrund or in our or on our territory, and then for those patients from Saxony who were transported from Wiesengrund further on and later on to another institutions in Bohemia, we have confronted them also with another entries in another archival sources. Yeah, please, the next one. The statistical analysis of this transport is that 375 of 485, which is more or less 77% patients of this so-called Außenstelle died in Bohemia. So the mortality rate was, I would say, extremely high. The most frequent cause of death being tuberculosis. 329 died directly in Wiesengrund in Western Bohemia, plus one in the hospital in nearby city of Pilsen. 45 died in the psychiatric hospitals in Kosmanos and Prague-Bohnitz because of the subsequent transport from Wiesengrund. 52 were transferred to Kosmanos, as mentioned, and Prague-Bohnitz because of the air raid of the Allied on Wiesengrund on April 17, 1943. 64 patients were dismissed, 4 escaped, 5 returned to Saxony in 1942 as individual transfers asked by the family and so on. And 2 of the Prague-Bohnitz subgroup only got back to Germany after the end of the war in 1945. As well as 9 patients from Wiesengrund. There is a phenomenon we have discussed yesterday, trying to understand a little bit the continuity of all these movements within the special groups, and the phenomenon is actually that we have some cases in which not only from the transport from Saxony, but also of, for example, those patients from Bavaria, when those being transported during the war stayed in our institutions even after 1945, without the families in Germany not knowing that these family members are still alive somewhere in our country. And this is, for example, this one female patient that stayed in the Czechoslovak social care institution after 1945. If we are thinking about the connection between the forced sterilizations and euthanasia, transfers, and so on, only one case of sterilization could be proven within this group. And in case of 19 patients, the fates remain unknown. So please, the next slide. What were the possible reasons actually for the transport from Arnsdorf? So essential here is the information that the Arnsdorf institution, and it can be added by our colleague Hansig, was a Zwischenanstalt of Pirna-Sonnenstein. As such, it had to cope with two extremely contradictory requirements from above. One, to make space for an extension of the existing provisional military hospital. And second, to support the Action T4, so it means to serve as a transit depot. The later issue requires, of course, a free passage of patients, providing only short-term hospitalizations with fluid bed capacity. It was really very much about the capacity. The Arnsdorf patients had obviously been selected in the negative way by the Berlin experts of T4, where to place them so that they didn't hinder the running of the Action T4 was question mark. But transferred to Wiesengrund because in Wiesengrund was free bed capacity. The question we have dealt with was if we can prove that this group was somehow medically pre-selected, but it cannot be proven because the spectrum of the diagnosis I'm going to show a little bit later was usual as we have seen in other contemporary institutions, maybe with just one slightly higher share of old age diseases. So it means that in the cohort of very old patients, there is the difference. So if there is something strange, then perhaps in the psychiatry of old persons. Many of the diagnoses would have been an indication to Nazi euthanasia if the patients had also fulfilled the indicator of hospitalization over 5 years, and at the same time, which had not proved themselves sufficiently useful at work, which we unfortunately don't know. So the transports to death were just starting in Wiesengrund. So there is a strange phenomenon. Please, the next slide. When, it's not seen on the right side, but there is a parallelity in case of Wiesengrund that first, the red numbers are showing the transport to death from Wiesengrund, most probably to Hardheim, which was 483. It cannot be seen, it's just over there below. So 483 patients from Wiesengrund were sent to death, and parallelly, 285 another patients from Saxony were admitted to become patients in Wiesengrund. So this is the exchange of the question of capacity of the beds. One example of this one psychiatric institution. Yeah. Here we have the financial aspect. So payments for the care in Wiesengrund. It was a great and very much and very heavily discussed issue. It seems that there was no general payment deal between Saxony and Reichsgasse Sudetenland. The financing ran on an individual basis. It means that it was left to be settled between Wiesengrund and a particular payer entity in Saxony from case to case. We can identify just 6 possible entities as such, with public sources prevailing. So county care associations, Bezirksfürsorgeverbände. Second, the municipal social care offices, Stadtwohlfahrtämter. Then also third, veterans care, of course, fourth, health insurance companies, fifth, Volksdeutsche Mittelstelle, for those Umsiedler, and also individual persons. In primarily Sudetenland patients, no payer was shown, and it was just they return home, at least from the financial point of view. In some other cases, no payer is just given or entered. So those patients usually subsequently died with the maximum latency of 5 weeks, which is quite interesting fact. Yeah, here you can see the case I have been mentioned already. It's just this lady who became a patient in Wiesengrund, then was transported in consequence of this emergency transports from Wiesengrund to Prague, stayed in our country after the end of the war, and remained again in Wiesengrund for reasons unknown, and died there in 19 65 at the age of 78 years. The last overview on the group of the Arnsdorf patients, it's more or less an overview concerning the diagnosis. Of course, we need to deal with more or less those diagnoses given by the contemporary sources. But of course, today we would understand them from the medical point of view in many cases differently. Nevertheless, this is a rough overview. So then the red number is just perhaps for your attention, that differentiated number in the case of the psychiatry of old age. But it's more or less a speculation. We think that there can be some kind of difference between the population coming in this age group, coming from the great cities and from the rural areas, because perhaps in the rural areas still the families took care about this, the elderly. So the elderly stayed in rural areas more in the families, in the care of the family members, while in the cities, of course, the health care was much more available at the institutional level of the health care institutions and psychiatric hospitals as well. So here's the next slide. Then we have the second group, which were another Saxon patients in our psychiatric institutions who came or were transported from Großschweinitz in March, 54 persons in March 1944, Hochweichen, 95 persons in April 1944, and also with this already mentioned emergency transport from Wiesengrund due to the air raid of the British Air Force, which was about 35 persons, 32 duplications having been subtracted. So there was a number of 171 Saxon patients or patients from Saxony, apart from the Arnsdorf contingent I've been talking about previously, which we can find in Bohemian institutions. This cohort consisted of 16 males and 155 females. So again, we can see that the gender ratio is not the same, but that the female patients prevail. The average age was about 47 years. Counting by 1944, and the span of age being between 17 and 84 years, again in 1944. 132 of them died in these two psychiatric hospitals in Bohemia, that means in Kosmanos and Prague-Bohnitz also, until the end of the war. Some of them, because there was this sort of spillover effect of the diseases until the quite unfortunate year 1946. So many of them died in Kosmanos, for example, at the end of 1946, already many years after the end of the war. And tuberculosis, again, was to be blamed for the death of the most of them. So about 67%. 19 of these patients were centralized to Kosmanos within the large ethnic exchange in the protectorate in 1940 already previously. So they had been scattered in protectorate psychiatric institutions in the past for reasons we don't know, unfortunately, on individual or probably also family basis, just being from the mix, perhaps being or coming from the mixed Czech-German families or something like that. So thank you. It's again the overview of the diagnosis for the second group of the Saxon patients, which is pretty similar to the Arnsdorf group, with this one exception I have mentioned already before, and that's this psychiatry of old age. It was a little bit less significant here. So conclusions, if I'm good with time.
Very good.
Okay. We can identify by name, going and comparing the different sources on our side, and partially also thanks to the colleagues from Pirna, from some Saxon institutions. In total, 656 psychiatric patients who were transported from Saxony to our psychiatric institutions, mostly these huge hospitals, at that time, of course, being divided into these two administrative parts of Bohemia and Moravia. These are quite complete statistics. So I can, if there is an interest, I can show you then the databases we have on our disposal. The mortality, as was already mentioned, was extremely high, with prevailing cause of death being tuberculosis. No significant differences in the diagnostic scope have been found in the so-called Arnsdorf patients as compared with other groups, with this one exception of a slightly higher share of old age diseases, which may be a point of some discussions. The Saxon Psychiatric Institution in Arnsdorf, Hochweitschen and Großschweidnitz accounted for most of the patients. 6, to be specific, 634. Nevertheless, the specific circumstances and reasons for sending the patients out of Saxony differed substantially in the case of Arnsdorf, as a sort of indirect and complex relation to Action T4 phase of expansion at the time of the expansion of the Nazi Reich in 1941, at the peak of this expansion, we may say, and compared with Hochweitschen and Großschweidnitz transports, which was just based on simple capacity reasons under Allied air raids in the declining phase of the Nazi regime and total war in more or less 1944. So this was my presentation. I hope that I succeeded with the time given to me.
No, the time was perfect.
Okay.
So thank you very much.